Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid. Today's video is going to be very short, and the whole purpose of this video is just to define what is cerebral perfusion pressure. We're going to discuss the formula for how it's calculated and why it's important. So let's go ahead and get into it. So in a clinical context, you may hear someone talk about cerebral perfusion pressure when you're in an ICU setting, maybe the trauma ICU, the medical ICU, or even in the emergency department. But the important piece to remember is that the definition of cerebral perfusion pressure, it is the net pressure gradient driving blood flow to the brain. And that's important, and I typed it out here, is that it needs to be within a certain range to keep the neurons alive. So if it's too low, you're not perfusing, or if it's too high, you run a risk of cerebral edema, a hemorrhagic transformation. So it's very important if you have a patient with a head injury, maybe a head bleed or a tumor, that you keep this within a certain range. Now there is a formula for this, and we're going to go ahead and discuss that next. Now here's the formula for calculating cerebral perfusion pressure. So it's going to be your MAP, which is your mean arterial pressure, minus ICP, which is your intracranial pressure, which brings us to the next point. So what are the normal values and ranges for all three of these? So here we go. We've taken that same formula and we've broken it down a little bit. So you just need to remember that cerebral perfusion pressure should remain in the physiologic range, which is regarded between 60 and 70, and that's millimeters of mercury. And then for MAP, which again is mean arterial pressure, you want that between 60 to 110. I've generally seen that a MAP goal is mostly going to be above 65, but when I was doing some research for this video, I was reading that 60 to 110 is acceptable. And then for intracranial pressure, that value is going to be between 5 and 15. And again, these are all measured in millimeters of mercury. All right, guys, that's all I have for you today. Again, very quick video. I just wanted to discuss what the definition of cerebral perfusion pressure was and then how to calculate it. And again, just keeping it very simple. As always, guys, like, comment, subscribe. And if you have a specific request for a topic you'd like me to discuss, please let me know. Thanks, and I'll see you guys next time.